Hello, I am Riccardo Panella. I am an associate professor at the Center for RNA Medicine at Aalborg University in the Copenhagen campus, and I'm also one of the co-founder and chief scientific officer of Resalis Therapeutics. So I discovered the role of miR22 in control several aspects of metabolism and started developing a therapy against miR22 when I was a postdoc at the Harvard Medical School. And now that GLP-1 are dominating the market, and they will dominate the market probably for decades to come, we thought that it would be smart to try to address some of the GLP-1 weakness. And so we start our combinatorial approach, because our therapeutic treatment is not acting on appetite. It produces body weight loss, acting only on fat mass, and produce an overall rewiring of metabolism that is preventing rebound after treatment period. So we think that this is very complementary to the GLP-1 approach and can be very efficient in using both approaches in a combinatory treatment. So at the European Congress of Obesity in Venice, we present data regarding our mouse model, different diet-induced mouse model, few data about the non-human primate model that we were able to run in the past years, and some data regarding human-derived organoids to prove that our therapeutic approach and what we observe in the preclinical model with our therapeutic approach is translated also to superior species till human. So our treatment approach is slow in the onset. Our therapeutic approach aims to remodel cellular metabolism, and in order to do that, there is some time required. So there is no immediate benefit in terms of body weight loss, but he requires a few weeks of acclimatation before start producing a strong effect on body weight. So the slow onset, it's something that we are trying to fix, and we are fixing it using GLP-1 and exploiting GLP-1 ability to be very efficacious in the short time. And then, as in all the microRNA approaches, the fact that we are targeting one microRNA, we are deregulating multiple targets. It's something that it's very promising, and it might be extremely a very good strategy to address complex disease that like obesity. There are systemic, multi-pathway, multi-tissue disease. The knowledge gap is that, we are proposing an antisense oligonucleotide based on RNA chemistry for silencing a microRNA. This is at the very cutting edge of pharma industry right now. There are very few programs with antisense oligonucleotide, and so we really have to be very careful and test all the possible talks and problems that can derive from an approach that is so innovative. And in being that innovative, there are always a knowledge gap in terms of the target. The role of this microRNA in metabolism is pretty well established, but of course the mechanism of action for RNA species, specifically non-coding RNA species, it's always pretty complex. So there is always some details in the mechanism of action that can be detangled better. So we just finished our GLP long talks in non-human primates. We are preparing as we speaking our IND enabling package, hopefully to submit the request for a CTA to the European regulatory agency by the end of the summer, and start our first in human in the fall.